Connected. Oh, okay. Okay. All right. Assalamu alaikum, everyone. My name is Dr. Fawad Malik. I'm a chiropractor at Achieve Physiotherapy and Rehab. Our clinic is located near 403 in Winston Churchill, so it's only a 5-minute drive from here. First of all, I want to say thank you to M&N for having me here today. We're going to discuss a pretty important topic. I'm sure everyone either have experienced or know someone in their family that has knee pain. So I think this is a good topic for me to talk about. And secondly, before we start, I just want to kind of explain to you, some of you might not know what a chiropractor is or what they do. So I did want to explain what we do as chiropractors. So as a chiropractor, we are specialized in assessing, diagnosing, and treating any conditions that are related to the spine, muscles, joints, and nerves. So contrary to what many believe, many think that chiropractors only specialize with the spine. We actually do specialize with everything else. So shoulders, knees, hips, ankles, whatever it is, every joint in the body. So I think it's good that I'll be talking about knee today because at least I can give you a better understanding as a chiropractor, the knowledge we know about knee conditions. I kind of split this into a few topics. I'm going to start off with just general basic anatomy of the knee. Not too much detail, it's just kind of give you where some of the structures are. And then from there, I'll talk about some of the most common conditions of knee pain. And then, there were a few lists of questions that typically patients would ask me in clinic that are pertaining to knee pain. So I thought I'd maybe address some of those because they're very common questions, and I'm sure some of you have those questions as well. And then we'll end it off with some of the exercises that I generally prescribe for patients that have knee pain. We're going to start off with just a little bit of anatomy of the knee. I'm not sure if you guys can see this from the camera, but so this would be my right knee. So I'd be standing here. Here's your knee. When you look at it from the back, you have your big bone at the top, so femur. This goes all the way to your hip. And then you have these two smaller bones, your tibia and your fibula. They go all the way down to your ankle. And then these are your quad muscles, quadriceps. These are big muscles. They go all the way up to the hip. And then in the back, you can't see, they've cut it off, but you're supposed to have your hamstring muscles here, and then your calf muscles down here. So those are the major muscle groups in this area. There are other smaller muscles, but these are the main muscles that most people know. And then from here, in terms of ligaments, you might hear that term all the time, ligaments. So there are 4 different ligaments around the knee. You have your MCL, which is this one right here, medial collateral ligament. You have your LCL, which is on the outside, lateral collateral ligament. And then you have your ACL, which is kind of deep here, but it actually kind of translates, it goes to the front. So it's your anterior cruciate ligament. And then in the back, you have your PCL. You might hear all the time, someone tore their ACL or tore their MCL. So those are your ligaments that kind of help support the knee joint. And then you might hear this term all the time, meniscus. So the meniscus are these two areas here. They're basically connective tissue. They're basically capsules of connective tissue, and basically their main purpose is to be shock absorbers of the knee. So when you're walking, they basically take all the load so that the knee joint itself doesn't take the whole pressure of you walking or putting force on the knee. So these meniscus, they're basically capsules that surround the joint. They basically protect your joint as much as they can. Okay. So those are the major muscles, joints, and the bones in the knee. I didn't discuss anything about nerves. There are a bunch of nerves that come down. It doesn't show it on this model, but that's okay. We're going to kind of stick with the muscles and the joint issues that patients have. So in terms of conditions, so one of the most common conditions that a lot of patients deal with is Patellofemoral Pain syndrome. So that is typically any pain that surrounds, oh sorry, I forgot to tell you one thing. You have your kneecap that's right here, right in the front. So it's kind of right behind this tendon. So that's kind of floating here. So the main common issue of Patellofemoral Pain syndrome is you get pain around the kneecap. There's a lot of reasons why patients might develop pain around the kneecap. The most common reason is through repetitive use. So you know, if you're doing a job or work where you require a lot of kneeling and coming up, lifting with that as well, that can cause a lot of pain around the kneecap. The most common reason as to why patients have patellofemoral pain issues is because of muscle imbalances. So you know, you have three major quad muscles at the top. The outside muscle is most commonly more dominant than the inside. So it's actually a lot more stronger and tight. And then the inside of the knee muscle, your quad muscle, tends to be very weak. So this kneecap, basically it's a free-floating bone. The way it's controlled is when you have these muscles come down, they form this tendon, and then they wrap around the kneecap, and they basically control the movement of the kneecap. So when I talk about muscle imbalance and muscle weakness, like, so if your inside of your quad muscles are weak and this is really strong on the outside and very tight, this will cause this kneecap to kind of, when you're straightening or bending your knee, it'll kind of push it out this way. And then a lot of times the kneecap gets pinched from the outside. And then that's when patients start to develop pain so around the kneecap. So a lot of times muscle imbalances can cause patellofemoral pain. So that's one common condition. Another common condition are strain injuries. So if a doctor ever says you have a muscle strain, that's basically saying you've injured your muscle. Again, that could be from trauma, sports, or you know, repetitive use. So if you ever strain a muscle, they will call that a strain injury. So anytime you injure a muscle, that's a strain injury. When muscles come closer to the bone, they form tendons. So these are your quadriceps muscles. This is your quadriceps tendon. So a lot of times, if you hear the term tendonitis, you hear that commonly. That basically means inflammation of the tendon. So tendonitis, itis means inflammation, and then tendon, so basically inflammation of the tendon. So anytime you hear the term tendonitis, that is really commonly related with strain injuries of the muscle. Another common injury, sprain injury. So strain is muscle, STR. Sprain is ligaments. So when you injure your ACL, your MCL, or your LCL or PCL, those are ligament injuries, so they call those sprain injuries. So you might hear you have a MCL sprain, so that means you've basically injured the medial collateral ligament. Or you might hear an ACL sprain, that's that ligament in the front here of the knee area. So sprain injuries typically relate to injuries to the actual ligaments. And ligaments are very important around the knee. They basically keep the knee intact. You can, if you notice, the ligaments basically go right across the joint on each side. And they basically want to keep this joint stable and in its place. When you sprain the muscle, when you sprain the ligament, you basically stretch it, then you start to lose a little bit of stability, okay? Another common injury or something you'll hear often is bursitis. Okay, so what bursa is they're these little fluid sacs, and they basically go between tendons and muscles and between the bone. They kind of sit between tendons and bones or between muscles and bones. And their main purpose is to allow the tendon to glide more smoothly instead of the tendon pinching on the bone. And a lot of times if, say, your muscles are really tight and you're doing a lot of repetitive kneeling, that bursa sometimes can get pinched. When it gets pinched, it can cause inflammation in the bursa. So that's when you are diagnosed with a bursitis. So in terms of bursa, bursas are all, like, they're everywhere, and they basically surround most of the bones and they go in between the muscles and the bones to make sure there's nothing that's getting rubbed against the bone. None of the muscles, tendons, or ligaments are rubbing against the bone. So that's a very common issue too. And then the final common injury that most patients will feel is, or will suffer with, is a meniscal injury. So meniscus, you've probably heard that term a lot. So like I was describing in the beginning, so the meniscus is basically this capsule that surrounds the joint. Its main purpose is to protect the joint. When you're walking, it's a shock absorber. So when you walk, all this force goes into the joint. That meniscus basically cushions these two bones, so it prevents the bone squishing the joint itself. So there's two common meniscal injuries. One is traumatic. That is typically, like a trauma. Say you're playing sports, you can tear your meniscus. Or say you were running and you kind of slipped, you can, while twisting your knee, you can kind of sprain or tear that meniscus. And then the second common reason for meniscal injuries is degenerative. So that's typically with older patients. With age, the meniscus tends to, and with age and with all that wear and tear throughout your life, the meniscus starts to kind of wear down. It starts to kind of tear down. So you start to get minor tears into the meniscus. It starts to break down. And then that's where you hear a lot of times patients are dealing with arthritis, osteoarthritis. That basically means this meniscus has basically, the cartilage has started to kind of break down and you don't have that support anymore. So now the joint's getting pinched, and sometimes if it gets really bad, both these bones are touching each other, and that's when patients start to develop a lot of pain. So the meniscus is a very common, or degenerative or osteoarthritis. Those two common terms are basically when that meniscus starts to kind of break down. Typically, naturally, most people, I get this question a lot. How did this arthritis develop? Naturally, with time, with age, everyone develops some form of degeneration in their joints. It's just with time, with age, with all that wear and tear on your body, all the pressure you put on your joints, they tend to start thinning. So typically, I think they say by the age of 60, 65, majority of the population has some form of degeneration and arthritis. Typically you can't really get away from it. With time, it does develop. I do find when at the end, we're going to show you some exercises. When you do a lot of daily exercises, you maintain good joint health, you maintain good health in the muscles, so it prevents the speed of the degeneration or the speed of the arthritis that you develop. Nowadays, sometimes in practice, I see patients in their 30s and 40s with mild degeneration or mild arthritis. Typically you shouldn't be developing arthritis at that age. It should typically start after the age of 50 or 60. So if you're developing arthritis at an early age, it most likely is because you're repetitively using your knee, possibly for work, and your muscles are very weak and they're not providing the support around the joint. So we'll talk about some of the exercises. So those are some of the common conditions in terms of knee pain, knee injuries. Some common questions I get in clinic all the time. One is, why do I have swelling around the knee? Why do I have stiffness around the knee? So generally, swelling develops when you have some irritation to either the muscles, the ligaments, or the joint. So say you have arthritis, or say you have a strain or a sprain in the ligament, that will start to develop fluid. And generally speaking, fluid usually builds up into a few spots. One is either it'll build up around the muscle at the top, so you might have some swelling above the knee, above the kneecap. So that typically, I think, most commonly occurs when you have some irritation to your quad muscles. Most commonly, patients will develop swelling below the kneecap. So I don't know if you guys can see this, but there's this little space here right below the kneecap. Because you have this little space, a lot of times when say your ligament or your tendon gets irritated, fluid will build up and it'll go into this space, and then it'll basically kind of get stuck there. So a lot of times when patients have a lot of swelling, they develop stiffness as well. It's because that swelling is compressing the joints, so it feels like your joints aren't able to move. There's too much pressure there because that fluid is building up pressure. I get this often in clinic where patients can't fully straighten their knee. That is another reason, the most common reason for not being able to straighten your knee is because you have all this swelling built up right below the kneecap. Most likely the reason why you're getting swelling that's building up in the knee is because of some irritation in either the joint. Arthritis can cause a lot of swelling, the muscle, and then if you have weakness in your muscles, they won't flush that fluid out. So I'll give you a really good exercise when we're doing the exercises on how to try to get rid of that swelling that's kind of stuck in there. Another common question I get, redness and warmth. Why does my knee feel really warm? That typically means you have inflammation in the knee. So generally inflammation is what causes that warm feeling around the knee. Again, why are you getting inflammation? It could be if a muscle is torn, if a ligament is torn, or that arthritis in the knee joint can tend to sometimes build fluid and build inflammation in the area. My rule of thumb, if you are feeling some inflammation or some warmth in the knee, stop any kind of kneeling activities or long walks, and you want to start icing it. Ice is the most effective way of getting rid of inflammation. I get this question often in clinic as well. Should I use heat or ice? Generally speaking, if it's a brand new injury that you just developed, within that first 7 to 10 days, the most effective way of getting rid of pain is through icing. So you would want to start with icing the first 7 to 10 days. After that, you can start heating. If it's something you're dealing with for long periods of time, it's a chronic injury, you have arthritis, generally speaking with arthritis, heat is more effective. If you have warmth or redness, you should always ice it first. If it's just swelling and stiffness, heat is more effective. So typically when patients come in, depending on timeline as to how long that injury is going on, I usually recommend which one to do, ice or heat. But if it's a brand new injury that you've just developed in the first couple of weeks, it's better to ice it first. And then if it's something that you're dealing with for months or years, then heat is more effective for that. Okay. Other questions I get, I feel like my knee is unstable, like it's wobbly, it's shaky, or sometimes when I'm walking, I feel like it's going to give out. A lot of times, that happens to patients that are dealing with chronic knee pain, and most of the time what's happening is their muscles are getting deconditioned. So doing like a daily knee strengthening exercise program really helps with that. Again, we'll discuss some of those. And then finally, another question I get a lot in clinic is, I hear a lot of popping or crunching or clicking in my knee. There's a few reasons why you can get clicking. If you have a meniscal injury or arthritis, that can cause a lot of crunchiness or clicking because now you've lost some of that cushioning. So it's just the bones sometimes hitting each other, and that's why you can get some clicking. Other reasons is, like I was discussing earlier, if you have muscle imbalance. So if one side is tighter than the other and one side is weak, sometimes that will pull the kneecap to one direction. And then when it gets pulled, when you try to bend the knee, you'll hear a click, a clunk right against the bone. So, once you correct the muscles, you strengthen one side, you stretch out the other, generally that clicking goes away. Okay? Okay, and then another thing that I commonly get asked in clinic is, what exercise should I avoid if I'm feeling a lot of pain in my knees? Generally speaking, if you have a lot of pain, you should avoid any exercises that cause a lot of jarring in the knee. So, I would probably avoid running, jumping exercises. Any repetitive kneeling can also cause a lot of pain in the knees. So sometimes taking a break from that. If you're praying and you find when you go into sajda, you get a lot of knee pain and you can't sit, then sometimes just taking like a week and maybe just praying on a chair can help take away some of that pain, and then once the pain reduces, then you can kind of get back into it. I definitely avoid running and jumping exercises. Walking is still to some extent good. If you have really severe arthritis, sometimes specialists recommend not to walk too much, but short walks are much better. You do want to continue walking because generally just for general circulation for the whole body, walking is very good and effective. And, for blood pressure and heart conditions, you want to maintain good heart, then, you do want to walk. You want to limit your walks to shorter times. So maybe instead of walking for 1 full hour, do maybe 10 to 15 minute walks 3-4 times a day, then you'll hit your 1 hour for the day. Sometimes if you walk for too long, that can cause a lot of issues as well. And then, you know, if you're dealing with a lot of knee pain, you can always try using a brace as well. Sometimes getting that support around the knee helps. Then you can walk a little bit more comfortably. In terms of other exercises, cardio-wise, most specialists recommend biking or swimming. Those two are the most effective cardiovascular exercises for knee issues. Specifically me, I've torn my ACL as well. I had knee surgery about 5 years ago. So for my first year, I basically swam 3 times a week and I biked twice a week. So that was my cardio for the first 3 to 4 months. Then I started walking, and then I think 10 months is when I started to do a little bit more jogging and running. So it's all about progression, but most specialists do recommend biking or swimming. I think elliptical is also good. With elliptical, the feet are not moving, so you're not compressively squeezing the knee joints. So sometimes elliptical might be a little bit more easier. So if you find walking is very difficult for you, then you can try some of these other cardiovascular exercises. Okay. So that's pretty much there. So in terms of exercises, I can come out here, right? Yeah, okay. All right, we'll switch up here. So in terms of exercises, generally speaking, what you want to do whenever you have knee issues is you want to improve flexibility. So you want to improve mobility in the knee, and then you also want to build the strength and the endurance in the knee. So both are, combining both will help condition your knee so that it can help reduce pain, and it can sometimes even completely get rid of your pain. So in terms of flexibility, stretching, the knee joint is not a very dynamic movement. You basically have 2 major movements. You either can bring it in or you can bring it out. Okay, so in terms of stretching, you want to stretch here, here, and down here. If you can stretch these 3 areas, that will improve a lot of the flexibility in your knee. So in terms of stretching this, your quads, basically you can use a towel, and what you want to do is you want to kind of hold this and try to bring your knee in all the way. Okay, it's easier to sometimes just lie down and just try to bring your knee all the way in. If you find you can't go all the way in, just go wherever you feel comfortable. Don't cause more pain, don't overstretch. If this is the furthest you can go, just hold it here for about 10-15 seconds, straighten it out, and then come back and then do that 10-15 times. You're going to notice if you do this 2-3 times a day, within a week, you're going to start to feel like you can go further, further, and further, and eventually you'll be able to go all the way in. Okay? Ideally, you want to be able to get your heel to touch your glute. If you can't, it's okay. With arthritis, sometimes you're not able to get all the way, but the more you can kind of work on trying to get that mobility in, the better it is. If you find like at the end it's really hard for you to get all the way in, then you can always just stand up, use some kind of support, and try to pull the knee in all the way. Okay? So that's how you stretch this area. If you want to stretch the back, the calf, basically for this, you want to keep the knee completely straight, and you want to hold on to something and just kind of pull your heel up, your foot up, okay? When you do this, you'll feel this stretch in the back. Okay, so that's the best way to kind of stretch the calf. Basically, yeah. So here's your toes. You want to try to pull the toes in, okay? If you can't reach your toes, then towel is much better. Hold it, try to pull. You can try to get a little bit further each time, okay? And then to stretch the hamstrings, same thing. You kind of hold this, but you want to keep the knee straight, and you want to kind of pull up and try to stretch back here. Okay, so you'll feel the stretch back here. All right. So typically for stretching, if you're just stretching for the first time, it's best to kind of stretch, hold it for about 5 to 10 seconds, and then do multiple reps of that. Do that 10 times. Then once you get better at it, then you can hold the stretch for longer. I typically hold my stretches for about 30 to 60 seconds. So, if you do 10 seconds 10 times, eventually if you start holding it for about 30 seconds, maybe you can do that, 3 or 4 times, okay? So those are the 3 stretches. In terms of strengthening, so same thing. You want to strengthen here, down here, and the calf. Okay, so the first thing, what I was talking about before, where we were saying I have patients all the time where they're not able to fully straighten their knee. So what I was saying was when you're not able to straighten the knee, either you're really weak up here or you have fluid built up around the knee, and that's preventing you from completely getting that knee down. So the best way to kind of try to work on that is try to prop up your knee a little bit with either a towel or a pillow, and what you want to start working on is you just want to push down, okay? When you're pushing down, you're basically, so here's your knee. When you're pushing down, you're basically trying to squeeze this. And then the fluid's stuck here. So when you push down, that fluid's going to push out, okay? So just work on trying to push this down, hold it for about 5 seconds, and then let go. And then you do that 10, 15 times. So once that fluid pushes out, it's going to be here. Then right away, put some ice on it, have your leg elevated, and then the fluid will start to move away from the knee, okay? So that's the best way to try to work on getting that knee straightened again, okay? So again, you start with holding it for about 5 seconds, let go, do that 10, 15 times. You're going to notice if you're having some pain, you're only going to be able to handle it for 5 seconds. Once you get better at it, you'll be able to hold it for maybe about 10 seconds, okay? So that's a good way to start getting some strength in your knee, or in your quad muscles, and it's also a good way to get rid of some of that fluid that's kind of developed in there. In terms of, so that's, actually that also helps to strengthen your quads. So other ways to kind of strengthen your quads, if you lie down into this position, keep this knee bent, use your hands as support, and just kind of raise your leg up, right up to your knee, your other knee, and then hold that for about 5 seconds, and then back down. Just try to make sure your knee is fully straight when you're doing this exercise, and then down. So you hold that for about 5 seconds. You're going to feel something pulling here. You might feel a little bit in your hamstrings. You might feel it down here as well. But it's a good way to start strengthening this. And then in terms of strengthening your hamstrings, so that's this big muscle in the back, there's a couple ways. One way is if you kind of stand, with some support, you can just kind of work on trying to squeeze that leg up. Hold it for about 5 seconds and then down. Or some people actually just lie down, face down, and then they work on trying to bring it up this way. Okay, and then in terms of strengthening your calf muscles, this also supports the knee because it kind of comes up to here. Very easy. Again, find something for support. You can use a wall or a table and just work on trying to raise up. And if you find that to be a little too easy, you could do 1 foot at a time as well. That's about it. So yeah, that basically helps to kind of strengthen the leg. Those are some of the general exercises. Another question I get all the time, should I be doing squats? In terms of squats, again, it depends on how bad the knee is. If you have really bad knees, you shouldn't be doing a full squat. What you can do is wall squats. So if you go against a wall and you only go down like maybe about a quarter of the way and then push up. But use the wall, lean against the wall so the support is against, okay. So you can kind of go into this position. Instead of going all the way down, you might feel some pain. Just go about halfway. Stop right here and then try to push up with your legs. Okay, so you can kind of start with that. I find if you go a quarter of the way, like just up to where I was, you don't feel too much knee pain, and you can start building some strength with the quad muscles. Okay, that's about it. Anybody have any questions? No? Yeah. Yeah, just some general strengthening exercises. What I'll do is I'll give these guys a handout of some exercises that I was talking about. If you generally follow like a good stretching, strengthening program daily, that helps. Do you wear the knee brace all the time, or is it just kind of on and off? Perfect, yeah. So, you shouldn't wear a knee brace the whole time. If you wear like a knee brace all the time, it basically takes over what your muscles are supposed to do. So you'll start to feel weaker. But if you're doing activity and you feel pain, like say you're going for a long walk, or did you say biking? Yeah, if you're going for a bike and you start to feel a little bit of pain, you can always put the knee brace on at that moment. But I find, how long has the pain been going on for approximately? Yeah, so it's like a chronic issue. I find for chronic issues like that in terms of knee, the best thing to do is just do some daily stretching and strengthening. If you work on some of the strengthening exercises I was showing you, I'll see if I can get these guys to send a handout to the mailing list. It really helps. It just keeps the knee stable. Like I was saying, I had knee surgery myself 4 or 5 years ago. Sometimes if I take a break where I'm not active for about a month, 2 months, I start to feel a little bit of stiffness in the knee too. Once I get back into some activity on a daily basis, it just kind of goes away. So it helps, yeah. Yeah. You would have to speak to a surgeon for that. I find if you're at a point where, I don't know where my model is, if you've lost your capsule completely, if you've lost the joints completely and it's basically bone on bone, and you've done physio, you've done exercises, and it's just the pain is not going away, sometimes that could be your last option, last resort, whereas they just do a full knee replacement. What they're basically doing is they're just cutting it off and they're putting a prosthetic there. So it takes away a lot of the pain. I've had patients with knee replacements and they found a lot of pain relief. But, you know, surgeons don't generally do knee replacements until you hit, I think, 60 or later in life, because those prosthetics only last about 25 years. So if they do it really early, say in your 50s, by the age of 75, they don't want to do another surgery. So I think that most surgeons will tell you to try some physio, try some exercises, see if that helps with your daily functional use rather than doing surgery. They try to keep that as a last resort. Yeah.
Walking would be good for him. Walking, like.
Yeah, like you know, but keep it as short walks. I don't know how much pain you have, but like, have you tried walking? Does it hurt?
I can walk.
Yeah.
7, 8, 10 kilometers. That's no problem.
Yeah.
Sometimes not. I mean, I can feel pain walking.
When you're walking, yeah. Do you wear the brace when you walk?
Yeah.
Okay. Yeah, no. You know, it's mixed. Some people say not to walk. I definitely recommend walking. Just keep the walks shorter distances, shorter times, and do that multiple times a day rather than one long walk. Like 15 minutes, like maybe, you know, 1 block or 1 kilometer. Like, do you go for like a 7, 8 kilometer straight walk?
No, at my work I can walk a lot.
Oh, okay. Yeah, for you know, like in terms of walking, like if it's just for recreational purposes, I usually tell patients, you know, if you find that you're getting a lot of pain when you're walking for like a half an hour, just keep it down to like 15-minute walks. Do that 3 times a day. You'll hit your, you know, 45 minutes, 60 minutes. For work, that's different now because you have to walk, right? You can't change that. So for something like that, you definitely should work on strengthening the knee. You know, when you start feeling some pain, maybe you could put the brace on for maybe a couple hours. Don't wear it the whole time or all the time, because sometimes that can take over what your muscles are supposed to do, and then your muscles start to get weaker. So I would advise, you know, trying to strengthen your knee as much as you can first, and then see if you can get better results or, you know, better reduction in pain long term for that. Yeah. Oh, sorry? Oh, yeah. So there's a couple multivitamins that a lot of people do recommend. One is glucosamine, and one is chondroitin sulfate. The research is mixed on it. You know, some have found it is effective, some have found not much of an effect. From patient experience, I do have patients that find it does help ease some of the knee pain they have. They're basically, those vitamins are supposed to help build some of the cartilage that, you know, you've possibly lost. So, you know, they do find some relief with it. So yeah, you can try those, glucosamine. Yeah, I'll send the name to these guys, and then maybe I'll get them to send it, yeah. Otherwise, pain relief, like it's out of my scope in terms of medication. That's not in my scope of practice, but you know, pain relief wise, topical creams are okay. Biofreeze, Voltaren, sometimes they can help a little bit. And then heating or ice. So icing, if you're feeling severe pain at the moment, you can always ice it. If you're just feeling just stiffness, heat is more effective for that. What? Awesome. All right. Jazakallah for having me, guys. If you have any other questions, I'll get them to send it to me.
It was about back pain for my mom. No, I don't think she has anything.
I can talk to you guys after about your back. Yeah.
Should I ask now?
Sure. Yeah.
So she was in an accident like years ago.
Okay.
So, like it caused, I think like she has a, I think it's a disconnect. It's like I don't know. It's kind of like her bone. Okay. Hello. Okay. So she has like lower back pain, and then she also has like a complication with her whole back because she also was in an accident, like a car accident, which I think like there's a separation or something, disconnection of a bone or something like that.
Degeneration? No.
No, not degeneration. It was like dislocated or something,
okay,
but they couldn't. Okay.
I don't know what to say. It was
I don't know. It's not my back.
Okay,
I was
okay,
not even
no
there.
Okay.
So the thing is, like, she had physio, and then she went through that. So that was like, I don't know, 10, 11 years ago. And then it's like never really fixed. But she's not she's not a candidate to get surgery. So it just causes her a lot of pain every day. So I don't know if you have any suggestions.
Yeah, I do find motor vehicle accidents put a major toll on the body, depending on how bad the accident was. So now it's been almost, what, 10, 11 years, you said?
Yeah. But
Yeah.
she like gets, like, so say if she has to do any kind of like anything tires her.
Yeah.
And so
probably
she gets
fatigues
also has
very
lower back pain, but that issue was here, like her
Okay.
higher back pain.
Okay. Yeah, so, motor vehicle accidents, we do see patients all the time in clinic with motor vehicle accidents. A lot of times patients do develop chronic pain. But, if it's been almost 10, 11 years, and, I'm sure, like, if you're standing for even 10 minutes doing activities at home, like cooking or cleaning, you probably start to feel some pain. Most likely that could be more related to, what's that term? Deconditioning. Yeah, you might have some deconditioning in your muscles. When you did physio, I know it was a long time ago, did they give you some exercises to work on?
They did, yeah.
Yeah.
And she has she doesn't do it anymore because her period of time with physio is over.
Okay.
She was required to do it.
Yeah.
But that's what I was thinking. Like, I feel like there must be something that can help her.
Yeah.
Like to decrease the pain, like maybe certain exercises.
Yeah, absolutely.
Because it's only getting worse.
Mm-hmm. Yeah, and once you stop, kind of like what I was saying about my knee, once I stop doing some exercises for a couple months, I start to kind of feel a little bit of stiffness or pain. If this is something that's been going on for a long time, she probably has some deconditioning in her muscles. Her muscles are probably really weak in the back. So if she can even get into like a general stretching program for her back, that can definitely help. I'll get your information. Maybe I can contact you guys and then help you with that a little bit.
Thank you.
In terms of like
Exactly.
pain like that, like in practice, like as a chiropractor, I also do acupuncture. I find chronic issues, acupuncture works really well. It helps reduce pain. Physio, massage, chiro, these treatments will help you, but I think if you don't maintain it at home with some form of exercise daily, it just starts to kind of gradually come back.
Like even 5 minutes, right? Like just she does 5 minutes, it helps to stretch.
Absolutely, yeah.
Because she has to take Tylenol every day.
Yeah, yeah.
And it doesn't do it. Like it doesn't fix it. Like it doesn't give her the relief she needs.
Tylenol would be temporary relief. I think sometimes fixing that posture, working on just a little bit of strengthening exercises at home can definitely make a big difference. Maybe help her with her daily activities as well. Yeah.
Okay. Thank you, Jazakallah khair.
You know what? I didn't bring it with me. Yeah. Don't worry. I'll get the information. Inshallah. Okay. The larger one is probably better. It kind of covers the full joint. It'll give you some of the support around the top and the bottom as well. Sometimes the smaller ones might not give enough. Yeah. But sometimes like patients find the smaller one is a little bit more flexible for them. Sometimes when you have a big one on, you kind of feel like there's something there. It's uncomfortable. So sometimes having something smaller gives you more comfort. It all depends, but I do find having a bigger one that will, kind of attach around your quad muscles will help support the quads in activating as well. Yeah, so probably a bigger one's better. It's long, eh? Yeah. Yeah, yeah. And the gel in the front, yeah. And do you still feel pain when you wear the brace?
A little bit less.
Okay, so it does give you the support, eh?
I can walk easily with it.
Yeah, okay.
Can I bring him to your clinic?
Absolutely, yeah. Yeah, for sure.
I was your actor when you were showing me the exercises that
It helped, right? Yeah.
that day.
Yeah. Yeah. For sure.
No, it's better than I can live with it.
Okay, Jazakallah everyone for coming out and having me here today. I hope I was able to answer some of the questions. Yeah.
Good information.
Yeah. Assalamu alaikum.
Yeah, you can see the knee. Take the knee with you.
So this is the kneecap, right?
Yeah. So this is your kneecap in the front. That one. That small bone right there.
Oh, this is this guy.
Yeah.
And this is, what is this?
So basically, these are your quad muscles. They form this tendon, and they basically cover that kneecap. This kneecap is just a free-floating bone. The kneecap is controlled by how your quads are. So, sometimes if you have really tight muscles on one side, it'll pull the kneecap one direction, then you'll get some pinching or pain.
So this is, so what is this?
So this is your joint, your knee joint here. This is your meniscus.